Hi there and welcome to this short video. So in this short video, I'm going to be talking to you about pregnancy and why it's so important that you, as a woman who is possibly pregnant at this moment or may be considering getting pregnant in the next few months or certainly the next 6 months, you seriously need to consider Bedford Chiropractic care. Hi there, Dr. Sandhu here from Bedford Chiropractic Clinic, the most experienced chiropractor in Bedford with over 25 years of experience. I've treated well over 30,000 patients and actually completed about 130,000 plus adjustments. So lots of experience, and as I say, the most experience here in Bedfordshire. How can I help you if you're pregnant or you're considering getting pregnant in the next 6 months? Well, it is really, really important that you look at chiropractic care as a good place to start right now. Because either way, either position, what's going to be happening is when it comes to the labor part, your child is going to hopefully have its head engaged and you're going to be putting an incredible amount of pressure in your pelvic girdle. And that pressure is going to create a strain on the muscles, joints, ligaments in that area. And generally, when the child is born, there is no guarantee, because unfortunately, women don't get checked after giving birth of how the pelvic girdle has dealt with that excessive strain that you just put in it. What happens is you release a hormone called oxytocin as you're in that stages of labor to give you some pain relief, but also, most importantly, to help you relax those tight ligaments and those muscles so that your body can open up and obviously the child be born. But there is no guarantee that when the child is born, that all of a sudden, everything goes back into place. And in 90% of my female patients who have given birth, either recently or maybe even 5, 10, 15, 20 years ago, are now struggling with a pelvic girdle that is unstable because the pubic symphysis is mostly affected because that thick muscles and tendons there, ligaments, have to go soft to allow you to open up, and nobody checks it. Well, that's one of the things we're going to be checking. But please understand that all these checks are done with you fully clothed. There is no internal examination at all. It's all done externally. And there are some other videos on my YouTube channel to help you to see what that involves. But also I want to point out to you what I'll be using. I'll be using this special cushion here, which is specially designed for pregnant women. Let me show you how it looks. If you just follow me. So this is my wonderful clinic where you'll be coming, and I'm just going to go into this room here and I'll show you. So this cushion sits on there. What you'll do is you'll kneel and you'll come down. And as you can see, the shape of it is designed to accommodate obviously the anterior bulge here, but also your breasts, and your neck will go here. Now, what that will allow you to do is will allow you to lie comfortably on your stomach for the first time during your pregnancy. And I can assure you that it is comfortable. This was actually made by a female chiropractor who was pregnant and needed something that she could use to get herself adjusted. And then what we're going to do is then I'm going to examine your spine and I'm going to examine your pelvic girdle, obviously having examined you from the front as well. And I will do some adjustments. Now, don't worry, I'm not going to be doing any of those forceful adjustments that you may have seen on YouTube. I'm going to be using a special tool called an activator. And what this tool does is this. So you can see there's not much happening there, but if I use this, okay, so it's very, very shallow, so it's not deep, but it's exceptionally fast. And I can assure you it is, in the majority of cases, painless. But what it does is it will help me to realign your joints, your muscles, and get everything back to normal. Because as you get an anterior bulge here, as a child grows, you are going to be putting much more stress in your lumbar spine and increasing the stress on the facet joints in your vertebra, which will then give you possibly some low back pain. So for all you women out there who are looking at getting pregnant or are in their pregnancy, please do consider chiropractic care because I can help you. You do not need to be in pain. You do not need to suffer with any kind of that horrible nerve pain you might be getting in the legs or even some back pain. And also, I can highly recommend that even if you're not struggling with pain, please consider just coming in for a checkup because we can avoid it. And prevention is always better than the cure. So, Dr. Sandhu, Bedford Chiropractic Clinic, all you need to do is give us a call. We'll get you fitted in today or as soon as possible. And I look forward to treating you and helping you have an incredible pregnancy and a pain-free labour. God bless you. Look forward to seeing you soon.